custodian of the land, the Larrakia people, on which we gather today, and pay my respect to the elders past, present, and emerging. I extend that respect to Aboriginal Australian people here with us today. My name is Matthew David. I'm a Multicultural Ambassador here at NG, and I will be your MC today. On behalf of Mental Health Foundation Australia, its patrons, Board of Directors, and Chairperson, Mr. Vassen Srinivasan, I would like to welcome you all to a major national Mental Health Month event, the Multicultural and Refugee Mental Health Symposium. National Mental Health Month is an initiative of the Mental Health Foundation Australia to advocate for and raise awareness of Australian mental health as a community. The MHFA's National Mental Health Month is unlike many other mental health awareness campaigns. It aims to bring all Australians together in a national-wide conversation about mental health. And we aim to maintain this conversation for an entire month and beyond through a series of events. National Mental Health Month is a program that the MHFA is extremely proud of, and we intend to reach out to and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussion surrounding mental health. With 1 in 5 Australians experiencing a mental illness, it is time we give mental health due attention. And that is exactly what MHFA is wanting to achieve. Throughout this month, many events have been organized in each state and territory of Australia, aiming to attract, unite Australians of all ages and backgrounds to raise awareness of the need of better mental health for all. This year, the theme of National Mental Health Month is Post-Pandemic Recovery Challenges and Resilience. This year's theme will focus on raising awareness about mental health in various industries and communities. Every individual has faced, and many are still facing, unprecedented challenges due to COVID-19. With this theme in mind, we aim to extend our campaign even wider than previous years, with events planned to embrace many different community groups and people of all ages working on the road to recovery and fostering resilience and recovery. In Northern Territory, we are holding the walk for mental health on Sunday the 17th. I think that starts at 10:30 at John Botanical Garden. If you have calendars, I will encourage you to add that event on the 17th of Sunday, the 17th of Sunday, 10:30 to 12:30. Today's symposium will focus on the mental health of the refugees and multicultural people. With greater knowledge comes the power to enhance outcomes of refugees and CAL communities. Please join us in celebrating the Mental Health Foundation Australia by viewing a short video.
Hi everyone, I'm Vassen Srinivasan, Chairperson of the Mental Health Foundation Australia. It's a privilege to lead this wonderful community-based mental health organisation in its 91st year of establishment. The MHFA has grown strength to strength over the past few years. With Victorian Mental Health Month in 2018, the National Mental Health Month occurring in 2019, 2020, and this year in 2021. Last year, COVID-19 did not stop us from achieving our National Mental Health Month campaign. I'm proud to say we successfully shifted many events to virtual format, very much being able to pursue our objective of raising awareness and advocating for better Australian mental health. Our primary aim is to reach out to and educate as many Australians as possible, to help reduce stigma and to encourage constructive and non-judgmental dialogue on Australia's critical mental health issue. The highlight of last year's campaign was reaching out to 100,000 Australians all across the country for our national walks for mental health, both virtually through our MHFA app and physically in some states. What a grand success that was. In 2021, with pandemic still affecting many of us, we decided not to give up once again, curating a carefully chosen blend of virtual and physical events for Australians to participate in. This year, we have a new and improved MHFA app, giving people the opportunity to participate in National Mental Health Month from the palms of their hands. This year, theme is mental health and post-pandemic recovery challenges and resilience. Mental Health Foundation Australia is proud to partner with Australian technology business DBS House and take up the wellbeing app Am I OK? To support our members, enabling individuals to regularly check in on a private and secure platform and ask the question, am I okay? Am I okay also alerts the user when it's time to seek outside help. We thank DB Results for this opportunity to promote well-being and early intervention. This year, we have launched a special initiative, the Mental Health Appeal on the 10th of October, our World Mental Health Day. Through this, we aim to raise funds for the development of a course promoting life and safety in young people. At the MHFA, we pride ourselves in making sure all of our programs are for the community and powered by the community. We have a vast growing network of multicultural ambassadors, youth ambassadors, and future leaders who further the community voice in promoting mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to assist individuals cope with success during the pandemic. I would like to take this moment to thank our board of directors and patrons, scientific advisory committee members, our wonderful staff, multicultural and youth ambassadors, future leaders, MHFA members and major sponsors for their continuous support to our organization as we continue to work to deepen understanding of the importance of mental well-being and educating the community. Let's work in solidarity for the benefit of our mental health. Thank you, Australia. Hi, everyone.
I would now like to introduce Has Mustafa, the Secretary of Mental Health Foundation Australia, who has sent through a pre-recorded message to formally welcome all of you here today. Has is the Secretary of Mental Health Foundation Australia. Has is a very proud Australian with a Turkish Cypriot heritage with very humble beginning who migrated to Australia with his family at the age of 10 at a time where you were expected to assimilate in the Australian way of life and not to be different. Multiculturalism was not promoted then, and he had very little support to learn the English language. Has under these very difficult circumstances was able to, in just over 5 years, learn the English language, pass his grades, and ripe old age of 16 obtained his first job at the non-State Bank of Victoria, which merged with Commonwealth Bank in 1991. Has is now a senior executive at Commonwealth Bank of Australia and is the General Manager, Multicultural Community Banking Australia, a division that initiated in establishing in August 2016. Has for over a quarter of a century now has been very active in promoting cultural diversity, both in the community and his workplace. His work in promoting cultural diversity in the community and the workplace was well acknowledged on the 2014's Queen's Birthday Honour List and was awarded the Order of Australian Medal for his services to multiculturalism and business. Has also served a 4-year term as a Commissioner at Victorian Mental Health Commission. Please join me in his video.
Good morning, everyone, and what a great pleasure to be with you today. Can I first begin by acknowledging the traditional custodians of the lands that we are meeting on today, wherever you may be. And today, I'm on the land of the Wurundjeri people of the Kulin Nation, and I pay my respects to their elders past, present and emerging. Can I also acknowledge Dr. Edward Lourdes Joseph JP, Deputy Chair, Federation of Ethnic Communities Councils of Australia, Savara Mamuri, Chair of the Ministerial Advisory Council of Multicultural Affairs, Boy Tai, Deputy Chair, Victorian Multicultural Commission, Associate Professor Dr. Lillian Buari, the Editor of the International Journals in Public Health, Kwame Salami, Chair of Refugee and Migrant Services Network, other distinguished guests, ladies and gentlemen. On behalf of the Mental Health Foundation Australia, I would like to welcome you all to today's event, Multicultural and Refugees Mental Health Symposium, on day 4 of the Mental Health Foundation Australia's National Mental Health Month campaign for 2021. This is an important event hosted by the Mental Health Foundation Australia, an organisation passionate about breaking down stigma and raising awareness of mental health within cold and refugee communities. Multicultural and refugee mental health is an important facet of mental health. Australia is an increasingly diverse multicultural country, with cultural landscapes having changed significantly over the last decade. Having this in mind, it is important for the mental health sector to provide targeted, and appropriate services for culturally and linguistically diverse communities. Migrants and refugees may face difficulties in gaining employment, integrating into the Australian environment where there's a lack of sufficient support services, in turn affecting various aspects of their lives. As you can see, migrant and refugee mental health is multifaceted, and unfortunately we see anxiety, depression and other mental health concerns in everyday life in multicultural communities. It is during events like this where we can discuss the barriers faced by communities in supporting their mental health to improve the support available to those who really need it. One of the initiatives for Mental Health Foundation that drew me to join the board of the Mental Health Foundation Australia was the opportunity to help establish the Multicultural Ambassador Program, a program that I'm very passionate about, with over 300 individuals across the nation to facilitate the task of tapping into multicultural communities, and I commend the work of our multicultural ambassadors in spreading the Mental Health Foundation Australia's message of better mental health for all, especially within their own communities. At the Mental Health Foundation, the oldest mental health foundation in Australia, we are committed to connecting with our multicultural communities to create an awareness of mental illness in our communities, to remove the perceived stigma that is attached to mental illness in multicultural communities. I personally have a strong view that every Australian that suffers from mental illness should feel no different than if they were suffering from asthma or diabetes. And the work that we are doing at Mental Health Foundation Australia is focused on initiatives that will make a real difference in the lives of all those Australians that suffer from mental illness. I hope that you will get a lot out of listening to so many great speakers today and take away some very valuable key messages. Once again, I congratulate the valuable work of Mental Health Foundation Australia and for organising today's event. And I pass it back to Matthew to continue with today's proceedings. Thank you and have a great day.
Thank you, first for a wonderful welcome address, and we will travel out to have you in person. I also want to acknowledge Mr. Luke Gosling, our Honourable MB is here, and thanks for your presence. And it is my great pleasure to invite Kwame Salome for a formal address. Kwame was born in West Africa. Kwame now lives in Laraka country in the Northern Territory. He chairs the ND Settlement Service Network to strategically progress settlement matters impacting humanitarian entrant and migrant settlement in NT. He has also been instrumental in leading systemic change that support refugees and migrant health. He is on the Refugee Council of Australia board as well as the Settlement Council of Australia board. He is an active member of Ministerial Advisory Council for the ND Minister for Multicultural Affairs. Kwame is the CEO of Melaleuca Australia, an organisation which is one of the Australia's 5 humanitarian settlement program provides, and also one of the 8 specialist organizations that provides a program of assistance to survivors of torture and trauma. Please join me in welcoming Kwame Salome on stage.
Hello everyone. Thank you for this opportunity to address you this morning. Like all of you, I am grateful to be addressing you on Laraki land, and I pay my respects to their elders past, present and emerging, and particularly for their kindness that they have shown for the time that I've been here. I was born in West Africa, and I'm one of 6 siblings. My father was Ghanaian, and my mother was Togolese. So consequently, I grew up between Ghana and Togo. And traditionally, from my father's tribe, we take on the identity of kinship as descendants of fishermen who live by the sea. However, my mother was a matriarch. And so we also took on the identity of people who are traders and who travel from land to land. When I was growing up, I had 5 important influences in my life. My grandmother, who was a blind woman, whose very existence was teaching me about things that are about sensations and stories that influenced morality, spirituality, and the fine line between good and bad. My aunt, who was a woman with a number of profound disabilities and who taught us about intuition, creative patience, and also a new language. And also my parents, who helped us to focus on the physical realm and the day-to-day things of living. And lastly, a woman who I met around the age of 7 called Untitled. And she was a beggar who lived on the streets. And she told us imaginative stories for about 11 years and taught me about the parts of the world that are outside of the world that I grew up in. So story is one of the most important elements that makes all of us. It molds us, it breaks us, it heals us, and it exposes us to others. There is a story that has been unfolding in the world for almost 2 years now. It is a backdrop of the world that we live in, and it is a story of the impact of COVID-19, which is changing everything as we know it. Today, we are here to discuss the theme of post-pandemic recovery challenges and resilience. I'm not going to talk to you about statistics or data or frameworks or systems. I think we will have plenty of time to do that. Instead, I'd like to talk to you about some of the collective fragmentations and the breaking down of the glue that binds communities. And to acknowledge that, and also to share some of that perspective. One of the stories that I grew up with is a story called the Sankofa. And it basically means to go back and find that which had previously impacted us, and to bring forward with it the lessons that we learned from that. So in order for us to talk about post-COVID impact, I think it would be good while it is still unfolding for us to go back. We know very well that almost a third of the Darwin population are people from diverse cultural backgrounds, people who have connections in other lands and in other parts of the world, and whose connections inspire and activate hope. Many of those connections being the source of decisions that are made to leave home and to find better opportunities to be able to keep families well. A person leaves home, they leave their loved ones to go and find a better opportunity. And in doing so, a synergistic activation occurs. Everything we do as human beings is somehow connected to others symbiotically. I lead an organization that settles humanitarian entrance into the Northern Territory, as you've heard. Many of the people we work with are people who have experienced torture, they experienced trauma, and this is just as a result of their displacement. And our work is to restore hope to lives that are shattered. However, the irony of that work is that it is because of them that we also look after our families. And if it wasn't because of them, there's a chance that our lives too will be shattered. Multicultural communities are predominantly collective. They or we bind in union to create a future with the here and now. We gather, we touch, we hold each other, we eat together, we witness beautiful rites of passage together, and we gather in masses to bury loved ones with age-old rituals that keep those alive dignified and those who are dead honored. All of those things are things of togetherness that have changed, and a new chaos has emerged as people worked hard to learn new ways. On top of that, including right here in Darwin, many people lost their jobs, and while loved ones are dying en masse, people have been feeling helpless because they are not able to assist even from a distance. And as life ends, opportunities to say farewell are not even given to loved ones. So we are crying, because everything has changed and the pain of loss is significant. And it suffices to say that people we love who are far away from us are also crying. Those circular customs and rituals that have mattered for generations by virtue of being multicultural means somewhere along the lines there is a link to someone who is valuable. And COVID-19 has changed it. And so for that, all of us became situationally disabled. When we see someone in distress, our body's natural move is to reach out, to touch them, to pull them close, and in doing so, we activate hormones that soothe. In the distance, we have not been able to do that. So the impact lingers. We hear the stories, and the trauma stays within us. I have, through the course of the last year, met many community leaders who tell me that they are unable to sleep anymore. They feel that they are unable to support their communities, and the level of distress and anxiety is escalating. So what does this all have to do with mental health? Everything. When the world stops the way this world has, the psychological and emotional impact of adjustment is significant. However, resilience is the capacity to recover from difficulty. The resilience that has been shown by multicultural communities over the past year has been exceptional. The new learning that has been gathered, the embracing of technology, and the commitment to find new ways of caring for each other. That is evidence that multicultural communities' tenacity to bond is unbreakable. I thank you for this opportunity to address you today. There is much to do. There is much that has already been done. And we live in a community that is full of people that are from collective communities, but that have come together to be collective in the here and now. And my call to action to you is to reach, listen, share, and bind to the best that we can. Because mental health is not about the person that we don't know about. It is about who we are and the person that is next to us. So I thank you very much for this opportunity.
Thank you, Kwame, for the insightful address. A token of appreciation will send to you shortly. Now it is my great pleasure to invite Dr. Shivaram Memori. Dr. Shivaram brings to the position over 50 years of higher education international experience. Ram worked in various academic institutions, including the University of Birmingham, Indian Institute of Technology, Yamaha University, University of Papua New Guinea, and Charles Darwin University. At this institution, he held several academic and administrative positions. Currently, Ram is an adjunct senior research fellow of the Asia Pacific College of Business and Law at Charles Darwin University, and chair and member of several advisory higher education and community boards, including the chair of the Ministerial Advisory Council of Multicultural Affairs. His research expertise is in economic application to contemporary issues. He has worked on several projects in interdisciplinary environmental management, healthcare planning, macroeconomic management, economic impact assessment, sustainable development, indigenous knowledge system in decision making, and natural resource management, including waste management. He has written extensively in applied economics, emphasizing the importance of human economic contribution rather than capital and finance. His work includes silence in organization, economic migration and formation of diasporas, economic pluralism, refugee entrepreneurship, and intersection of multiculturalism and ethics. He is also the editor-in-chief of the International Journal of Healthcare and Behavioral Science. Please welcome Dr. Shivaram Memori on stage. Yeah, of course, sure. And good morning. I want to
the past, the present, and the emerging leaders. Not only in terms of how much resilience they've had in actually straddling so many cultures, but also in terms of their celebration of the concept of because of her we can, the Noidok week celebrations from a couple of years ago. I want to pay my respects and welcome to the honorable member of Blue Cosa, and also in terms of the esteemed members here. My theme actually is very similar to Kwame, although we have not exchanged notes. Part of the reason I was invited to speak, actually I'm a substitute speaker, because it was supposed to be, I was nominated by Srinivasan to actually stand here and address you, because I think they wanted gender balance and gender inclusion and so on. And they think that only women can represent the gender. But I think there are a lot of us who can actually represent our thinking as well in terms of this. Because I believe that one of the core principles underlying the COVID that has actually brought us into limelight was that we have to do things differently. If we want to do more of the same, no matter how much statistics, how much data you're going to provide, people don't seem to understand that statistics is generated because of a framework we adopt. It doesn't come from thin air. It's the mental model. It's the model that every drummer boy and drummer girl in our heads has got. And it's a model that says that we have got a situation where multicultural populations are referred to the atrocities of the past and celebration of the future and emerging great people that have achieved great levels of positions. But guess what? The reality is that there are perhaps much more people who are the ordinary flesh and blood of human beings than the stalwarts and the systems and the award winners, etc., etc., etc. Because mental health is everyone is affected by it. Kwame, thank you very much for giving that inspiration. Because the fact of the matter is that mental health is an issue not about mental ill health. It's not about statistics that's gone up saying 1 to 5 people are mentally affected. I think the 100% of the population has got mental issues, as much as anybody else. Remember the concept of the drummer boy and the drummer girl that we talked about. It's that concept that I want to address today in a few minutes that I've got. And it is that construct that I want to look at from the point of view of the Larakia people's approach to the mindset. As I said earlier, the two phenomenal lessons that I've learned through my own doctoral students, as much as through a lot of people who have interacted with me and have given me the knowledge freely, but yet I say to them, I'm a bad student, because my framework, my drummer boy, is shaped by what I have been trained to do, what I've been taught to do. So I decided to actually start thinking about the flesh and the blood of the human mind, rather than the framework that we superimpose in order to have a debate and a discussion and a measurement and a policy and blah, 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 and recognition, blah, 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 and based in terms of the framework that we actually provide. I think the fundamental issue that COVID has given us is a great opportunity to think about what kind of framework can we possibly have. You know, people talk about the myth busters. You know, first of all, there's a myth and we bust the myth. I ask the question, why does the myth exist in the first place? And then people talk about it in terms of measurement and quantity, quantification, as if the decisions have to be based on the more miserable people are, the more urgent the requirement is for the purposes of doing whatever we want to do. So that they help with the rest of the world because they are not important, they have not reached that critical mass for my attention. What a colossal tragedy of the human mind. So I want to challenge that. I want to be in a position to say to you that one of the fundamental things that we learn from the women in the world is the resilience that they show, irrespective of the conditions under which we actually operate, at the family level, at the individual level. Have you not noticed when Kwame was addressing, he addressed 3 women and 1 man as his influence? Fascinating, isn't it? When you actually think about the problems that COVID has created, it has challenged the very essence of the focus of attention. The focus of attention away from many aspects of our day-to-day living existence. And I think it is that particular framework that we need to actually start to think about, saying that we all matter. The esteemed people who spoke about earlier, I just took very quick notes, in terms of saying that every dialogue is important, and also us talking about it in terms of better mental health for all people. You don't have to actually be a statistic in the hospital data. You don't have to be a statistics in terms of the policy making framework. You don't have to be a statistics in any of these issues before attention is paid to the ordinary man and woman and child suffering from silence of mental health and responding in a resilient manner to the existence of the opportunities that they have got for the purposes of migration as well as for the purposes of being a refugee. Just like the indigenous people have taught me about what it is to be resilient, what it is to have the notion of straddling between cultures. Imagine the number of people. In fact, there is a doctoral student of mine who's almost completed his title is straddling. He's a Larakia elder man. And he says, Doc, can I possibly finish it before I die? Because I want to, but because the statistics tells me I'm already dead a few years ago. So the fact of the matter is, when you actually think about this, you say to yourself, what is the greatness of each individual human being here? Is the story of resilience, the story of success for the individual, that he or she did not end up in the statistics of saying 100% mental health problem. What that means is, for me, asking a very fundamental question. If you want to go along the line of saying that what is required here is to look at how women, in particular, migrant women, in particular, linguistically different women, in particular, those people who went through the atrocities of policies and who are subjected to other atrocities of policies, then the question really becomes, how on earth are you still alive? Not only alive, how on earth are you actually still contributing to the welfare of your own family circumstances? And this is a great challenge for us to understand before we can actually prescribe policies. I'm not saying hold on to the policies. I'm saying continue with what you have been doing, But remember, at the back of all those policies is a framework of mind. And if that framework of mind is not applicable in reality to what is actually happening, you would certainly have to start questioning that. Fair enough? Thank you.
So I'm always a big fan of Shriram, but wherever around there, I'm almost there. So I don't want to stop it, but I have to stop it.
I'm not excited.
Thanks for your support today, and token of appreciation will send to you shortly. I would now like to introduce Eleni Samuel from Australian Unity to say words as MHFA's major sponsor for National Mental Health Month 2021. Eleni has sent through a recorded address for us today. So Eleni is African-Australian from an Ethiopian background who has focused her life's work on strengthening education, training and employment for culturally and linguistically diverse communities in Australia. She worked for 17 years in higher education sector. Eleni is now Executive Manager, Diversity and Capability Development at Australian Unity. Eleni's dynamic leadership has resulted in new solutions for the community to access and participate in society. She is particularly passionate about improving the lives of older Australians through responsive aged care. Eleni was the only first-generation migrant refugee background served on the board of SPS, the Royal Women's Hospital, Western Health Hospital, Australian Social Inclusion, and VMC Commissioner from African background. Eleni is currently on the board of Royal Children's Hospital and Wellbase. In 2014, Eleni was named by Westpac AFR as one of Australia's 100 Women of Influence. Eleni was made a member of Order of Australia in 2019 Australian Day of Honours. Please join me in viewing Eleni's video.
Good morning. I would like to begin by acknowledging the Wurundjeri people of the Kulin Nation, the traditional custodians of the land which I am on today, and pay my respect to the elders, past, present, and emerging. I also want to thank the federal, state, and local government representatives, community leaders, and all attendees who have joined us today. Your presence demonstrates your commitment to mental health, and I appreciate you are here today. For those of you who don't know me, my name is Srinivasan Samuel. I'm the Executive Manager, Diversity and Capability Development for Independent and Assisted Living at Australian Unity. I am really privileged to be representing Australian Unity and Mental Health Foundation, two like-minded organizations steeped in a long history of working to improve the quality life of the community. Across the month of October, a range of events have been organized to foster community resilience as we navigate our way through the COVID-19 pandemic. The COVID-19 pandemic is posing significant health, lifestyle, and economic challenges for Australia, and evidence shows that this is likely to be significant negative mental health impact as a result. The COVID-19 pandemic has had major impact on the mental health of Australians from refugee and migrant backgrounds. Australia's mental health sector has been responding to the increasing support needs of Australians with new approaches, including the expansion of digital services, telehealth, as well as innovative community-based model of care. However, the remains are that the need would be addressed in the immediate and long-term responses. For 180 years, Australian have been delivering products and services that contribute to the real well-being of our members, employees, and broader Australian community. We have supported Australians through times of war, financial crisis, and natural disaster, as well as in the recovery and building efforts that followed those shattering events. Today, we face a once-in-a-lifetime pandemic, and our approach remains the same. Like Australia, the Mental Health Foundation Australia has a long history of working to improve the well-being of the community. This is our third year we have been working together for Mental Health Month. Mental Health Month is an important opportunity to raise awareness about the importance of mental health and the support available to help improve our sense of well-being. The Royal Commission into Victorian Mental Health System, which released its report in March 2021, found that the mental health system in Victoria was broken and does not meet the needs of all Victorian community. The Royal Commission also found that the Victorian mental health system is not culturally responsive for people from migrant and refugee communities. Many people from migrant and refugee background found that mental health services do not understand their languages, cultures, and experiences, and so many mental health services are unsafe and exclusionary. Australians from refugee and migrant background, particularly those with language barriers and limited social networks, face with specific challenges and vulnerability that must be taken into account when we consider planning services. We strongly emphasize the need for inclusive national public health measures to ensure Australians from migrant and refugee backgrounds have the same access to services as mainstream Australians. Australian Unity is demonstrating its leadership and ongoing commitment to health and well-being of Aboriginal and Torres Strait Islanders communities through many of the services, including our recent development of Healing Minds program. Healing Minds program was jointly developed by Australian Unity and Indigenous Services and Remedy Healthcare Divisions. Healing Minds is a culturally sensitive adaptation of Mind Step program. Healing Minds program is a confidential, phone-based mental health coaching program developed by our First Nations and delivered by Aboriginal coaches. The Healing Minds program launched this year, and we are also planning to adopt the program for culturally and linguistically diverse Australians. Mental health is an important opportunity to raise awareness about the impacts of mental ill health and the range of support services available that improve our sense of well-being. Australian Unity is a company founded on social value and community contribution, and we are committed to building and promoting positive mental health strategies. We will continue to identify and help solve the healthcare and well-being needs of our broader community. Australian Unity is proud to support the great work of Mental Health Foundation Australia. We are encouraging everybody to work together to address one of our country's greatest challenges, the mental health of our nation. Thank you.
Thank you, Eleni, and thank you, Australian Unity, for the continued support. Now, I would like to invite Dr. Vin Joseph for a keynote address. As we know, Edwin is passionate about serving the community and being active in public life. He has got multidisciplinary education, including a doctoral degree. His experience is multifaceted, working for private and public sectors, including roles in education, HR, project management, community engagement, research policy, etc. Having migrated to Australia as an adult, Edwin understands the problems faced by Cal population in Australia. Dr. Edwin is currently President of Multicultural Council of Northern Territory, Deputy Chair of the Federation of Ethnic Communities Council of Australia, Vice Chair of Australia Day Council Northern Territory, Treasurer of Darwin Asylum Seeker Support and Advocacy Network, and MD Convener of Religious for Peace Australia, and a fellow Multicultural Ambassador of the Mental Health Foundation here in the Northern Territory. Please join me in welcoming Dr. Vin Joseph.
ladies and gentlemen. It's my pleasure and privilege to speak about mental health for migrants and refugees in Australia in the post-pandemic era. Before I continue, I would like to acknowledge Slovakia people who have been custodians of this beautiful land, which attracted millions of migrants right from the days of European settlement until today, so that first-generation migrants like me can live in harmony along with first Australians. While COVID-19 has taken toll on everyone, impact has been catastrophic for migrant population, which is not duly acknowledged by our social and political systems. This symposium is a good attempt to bring those issues to the light, and I laud Mental Health Foundation for organizing this. A 2021 publication of World Health Organization defines mental health as a state of well-being in which an individual can realize his or her own potential, cope with the normal stresses of life, work productively, and contribute to the community. This definition makes it obvious that our mental health is very much related to several aspects of our day-to-day life. Migration itself would pose a lot of challenges to a migrant. In particular, for those migrating from a very different home country, differences might be based on economy, ethnicity, culture, language, etc. Needless to say, those challenges might not be severe for people moving from the UK when compared to people moving from Asian, African, Indian, Arab backgrounds because of the differences I mentioned earlier. So, I don't think these are well recognized in our Australian community. Inclusiveness is different from diversity. When you say diverse, everyone is there, but are they recognized? That leads to inclusiveness. I would say one example. I was looking at NTG and they did a Christmas decoration. They went to every section of that department, like Palmerston, Casuarina, to judge. I was a member of the judging panel. I think 3 or 4 people were member of the judging panel. So one of my a judging panel member was asking question to a person of Indian migrant. She assumed that because she was asking him, how do you celebrate Christmas in your country? And he is a migrant, he's working here. He was struggling to answer, which she didn't understand. But as a migrant, I could understand. I am basically a Christian. I know for me, in many of these countries, Christmas is a religious celebration. It's not their cultural celebration. So this is ignorance the person had to suffer in this workplace. If he says that I don't know about Christmas, we don't celebrate, it will be looked differently by this person. So the ignorance of the mainstream Australian population itself causes a lot of trouble to others. And lack of recognition of their own culture will definitely affect mental health of a person, which would be more for migrants. And with the harder migration rule, life has become harder for many migrants who have to navigate the current stringent visa and immigration systems. With the current immigration system, I would say migration has become harder than when it was during White Australia policy before 1975. Migrating to Australia is harder now. That is very true, which everyone would say yes. Temporary, what happened with the COVID? Temporary and migrants and international students were not eligible to access government payments. There were thousands of students who contributed a great extent for the GDP of Australia. International education is one of the main contributors of GDP, which Dr. Vimuri, the economist, would agree with that as well. So they came with a plan. When the things were closed, they had to suffer, many of the students, and they were not able to access government payments. And it may not be noticeable to mainstream Australians to see the extra burden, difficulties the post-pandemic issues have based on migrants and refugees living in Australia. There were some temporary migrants who went for holidays. They got their rented home here, leased home here. They couldn't return due to travel exemptions. They were paying rent without earning any money. And with their currency back home or their income, it was very hard to pay them, they had to loan. And finally they had to find someone to vacate their home with something. And also with all these things, what is the view of multicultural people on mental health? The WHO Constitution, World Health Organization Constitution defines health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. But for many of the migrant population, it is not the case due to the competitive nature of culture in their country, because they are not very developed in those countries. The economic development was not that high in those countries. But there is growing recognition within the international community that invisible disabilities such as mental health is one of the most neglected yet essential development issues in achieving internationally agreed development goals. This can be described further by considering how people from third world countries view their mental health. Most people from third world countries view their mental health differently from mainstream Australian society. They have come from an unfair and highly competitive work and social culture that varies from Australian culture. And one more thing is, persons from cold backgrounds with mental and psychological disabilities often face stigma and discrimination in their own community. So they don't come public with that. Almost 1 million people die due to suicide every year, and it is the third leading cause of death among young people. I could also see a person who has faced a big tragedy because of suicide in their family here. I don't want to mention the name. Maybe, yeah, she's here. And why I tell all this thing is, as I said earlier, there is an internationally agreed development goals which Australia should think of. Australia is a developed country, and many of the Western world, where Australia is most aligned with, even though geographically it is located in the east, do not recognize Singapore with all its infrastructure as a developed country. One of the main reasons they told is, if you see the human resource index, it's not good in Singapore because for their citizens get benefits. But what about the migrant workers working there? There is no low income limit and stuff. That is very good. That's a very, very good acknowledgement. So they don't recognize Singapore as a developed country because the people living from, with the migrant people who living there without visas, their human resource index, if you check that, is very zero. They are still suffering. So Australia should use that standard for themselves as well. They need to consider that type of thing is happening with mental health for the people who are here. It's not with the pay, with so many other things that is happening. Statistics, based on the ABS, Australian Bureau of Statistics, there were 7.6 million migrants living in Australia. In the NT, overseas-born migrants comprise of 23% population. The Australian population increased by 194,000 in 1 year, almost a year, due to net overseas migration. So the population is growing because of this migration. With these things, when these statistics are taken, are they being considered when policies and other actions, government programs are implemented? I wouldn't say yes, because I happened to read a discussion paper of Judicial Impartiality Commission. There were 7 or 8 places they mentioned about the cultural competencies of judges. And some of the places they mentioned about the indigenous cultural competency, which is very good, it should be recognized. But nowhere they mentioned about this much, this much big, group of migrants living here. I know a personal incident that happened in Darwin. A person was put in jail without bail for 18 months, and he lost his student visa because when somebody is in jail, they don't think about visa. I don't know what happened to him after that. Without bail means, that means, I would say one of the people mentioned, it must be due to the gesture of, his gesture didn't go well with the judge from a Caucasian background. So, cultural competence should be there for judges, and I got an opportunity, we and MCND got an opportunity to talk to that because of this experience. When we got this opportunity, we presented it to the Judicial Impartiality Commission. We are not legal people, but I told them, probably we are the only community organization in the NT who did some oral submission for them, because we have seen that happening. And what extra burden people have faced? Family separation, and so has caused social isolation. So people, temporary residents, some of the kids were separated from their parents. One person when overseas couldn't return. And I know Matthews is getting up, so it means I need to finish quickly. So I would jump quickly. So it is really like, causing a lot of trouble to people. People even with the permanent and residents and citizens, they couldn't go to back home even when a family member died. And it happened in my family, I couldn't go. It happened in even one more, I'm seeing one more person, their sibling died here. Dr. Remuri couldn't come. So there are so many people who are it may not happen to a non-migrant person. So this would cause, a lot of these things would cause more impact on put more adverse effect on migrant population. And think of what is happening in Afghanistan. So there are people who are here, their family members are there. What would they do? It doesn't happen to a normal person who was born here and having the whole family in Australia. So the government policies, what action needs to be done for this? Government policy should acknowledge this thing, the extra burden people are facing. So what we can do, we can promote mental health among people from culturally and linguistically diverse backgrounds who do not have an awareness of their rights in relation to their mental health. Multilingual educations, virtual webinars, things like that MHFI, Mental Health Foundation is doing now, should continue during the post-pandemic period. So introduction of mental health plans to people of multicultural backgrounds, community consultation with the multicultural communities to determine what they think about their mental health. So many of the jurisdictions except NT have considered, give special emphasis to in their mental health act about this, at a cultural consideration for migrant population, but somehow MC and the other fellow multicultural ambassador Matthews, we could talk to the government. It is good that they are going to incorporate that thing in the NT Act as well, in the review of the NT Act. And I think, so the thing is, we need to promote what migrants are contributing to this country, and especially to the NT. Migration is a key economic driver. I was attending the Digital Pulse launch last week done by Australian Computer Society. The Digital Pulse was developed by Deloitte, they are professionals in that subject, and they clearly mentioned because of non-migration due to these issues, there is a shortage of workers in the industry. And the South Australian governor was a refugee once. He came on a boat. He's now the governor of South Australia. So how people can contribute, what they can do, we need to consider. And I thank you for your patient listening. I don't want to cause much mental health issues to you. Thank you for coming.
Thanks, Edwin. We'll send you a gesture of appreciation shortly. And probably next year we should run this for a day. And I know the time is not enough to talk about mental health. So I would now welcome Dr. Lillian Monari for a keynote address, who was very kindly flown in from Adelaide to speak at today's event. Associate Professor Dr. Lilian was born in Tanzania, East Africa, and graduated in medicine from the University of Dar es Salaam in 1991. She held senior positions in both clinical and public health medicine in Tanzania before migrating to Australia in 1998. In Australia, Lilian has worked in a wide range of settings such as government, communities, and in academia. Lilian has Masters of Community Nutrition degree from University of Queensland and PhD from University of Adelaide. She is also a fellow of Australasian Faculty of Public Health Medicine, the Royal Australasian College of Physicians. As a public health physician, she has gained a vast and extensive experience in a wide range of issues, public health, including health promotion, epidemiology, ethics, chronic disease, mental health, community engagement, and community development. She has worked with many migrants, especially Africans in Australia, to address a wide range of health issues. Her experience and interest in migration and public health medicines has seen her conducting research activities in healthy aging, physical activity and mental health, HIV and other chronic diseases in culturally and diverse populations. She collaborates with many migrant communities and organizations across Australia and has worked in the government institutions, including SA Health. She is currently working in public health practice and academia at Flinders University of South Australia. She has significant roles in teaching, high degree by research supervision, and research in public health medicines. Lilian has over 120 academic publications, mostly in CAL populations and global health. During the last 15 years, she has focused her research in CAL populations, including in issues related to aging, chronic conditions, and mental health, especially of young people. She currently serves on several advisory groups. She is an editor of the international journals in public health and presented in many local and international conferences. Her main research interests currently include CAL population, general issues, and social and health inequality, inequities research that makes a difference in improving policy, practice, and service delivery, especially for CAL migrants and refugees in Australia and global health. Please join me in welcoming Associate Professor Monari.
Good morning, everybody, and thank you so much, Matthew, for that introduction. And before I start, I'd like to acknowledge the traditional people of this land, the Larakia people, who are the owners of the Darwin region. I pay my respect to the elders, past, present, and the future. And I must say, I'm really excited and delighted to be here. I've just come from South Australia. And for the past 2 years, this is my first overseas or international travel. So how exciting it is to be in a plane for such a long time. So it's really exciting, and particularly to be able to come to Darwin. I haven't been here for a long time. Last time I came here was 2007, I think. So many things have changed. It's another era whereby we are being challenged by a lot of things, particularly the COVID. So my colleagues or previous speakers have talked a lot about what I was going to talk, but it's also very good because I'm relating to Sankofa. The Sankofa is a story whereby we don't only look at what is present and what is coming, but also go back and see what is the elephant in the room. So for this, now I have changed a little bit of what I was going to talk. So I'm really excited because many of the issues which we face in mental health cannot be quantified or cannot be finished. So there's so many. We acknowledge that the people from Multicultural are known to be really disproportionately affected by mental health, and we acknowledge this. We know in Australia we have a lot of people from cultural and linguistically diverse populations. 30% of Australian population is migrants, so it's not necessarily a small number. It's a big number of people who are from the other cultures, and their issues are very important. Although we know that in Australia we have really, really good mental health services, the issues of migrants are very severe. And because I'm an academic, I'm going to talk about a little bit about my research, which I've done in recent times about accessibility to mental health issues. because we know even before COVID, migrants, particularly those with cultural diversity, they have a lot of mental health issues. And for that, we have to look at the system and how do the system serve these people and how do people themselves serve or perceive the system. We know the system is fragmented, the accessibility is very poor, and the availability, even the aim or the seeking behaviors of migrants is very, very low. So even though the services are available, the accessibility is very, very poor. And the burden of the COVID, which has really entrenched our communities, and currently we are fighting so many things, and not only the COVID, but there are also extra responsibilities of time which we have to deal with addressing the COVID, with funds and money which we have to work with to send back home because of the issues which are arising there. And this is compounded by the loss of the jobs, as we have heard from the previous speakers. A lot of migrants and cohort migrants have lost their jobs. So there's a lot of compounding issues which really lead to mental health issues or exacerbating mental health issues in Australia. As an academic, I've read a lot and I've produced a lot of evidence which suggests that mental health services are underutilized by the cohort migrants compared to the general migrants. And this is not much acknowledged because of people, as Edwin talked about, they don't come out because of a lot of issues such as stigma. And it's not only stigma, the policies which are to help people, they are not acknowledging much of the cohort migrants because policies are general and they assume that the cohort or even migrants are homogeneous population. People are not homogeneous. There are so many layers of culture, so many layers of differences. And if you cater and provide services which are homogeneous, they are not really accessible to other people as well. Other issues are poor health literacy, including unfamiliarity with the service. Most people don't know about the service, and the issues of confidentiality are hindering the accessibility of mental health issues. As I said before, I'm an academic and I'm going to provide a little bit of my recent study which we did about strengthening accessibility of services among African populations in South Australia. So in order to identify more specific needs of mental health services or issues which hinder accessibility to mental health services, we did a qualitative study of African migrants. And we interviewed both African migrants and the service providers. And I relate with Dr. Lemur when he said you don't necessarily quantify how many people have mental health in order for you to understand this. So the stories and issues which came from these studies were very insightful and really having a lot of information which can be used to understand barriers and other issues which affect accessibility of mental health services among African migrants in Australia, and this will be related to other states as well. So in our findings, we identified 3 themes related to accessibility of mental health services within African migrants in South Australia. So one of the themes was some of the issues which are personal issues, so people not really understanding the mental health problems themselves. Some people think that if I have mental health then I have to be running across the road, really shouting and having major episodes of mental health. So these other issues, anxiety, which Dr. Moore was talking about, issues which are very silent in families or individuals, were not recognized as mental health issues. And this was compounded because the mental health services were also not very well understood, so people would not access these services because of lack of understanding. And most participants, we interviewed both males and females, they acknowledge that they don't know the services, or they didn't recognize the services which were available for them, even though we know there is limited accessibility of services for cultural migrants. So another factor which we theorized as personal factors was a lack of perceived benefits of mental health services. So poor perceptions of benefits of mental health services seem to be a big problem, because if you don't even know about any services, then you don't have the tendency of going to access that. And as we know, most of the cold migrants, which said in the heard from Edwin and also Dr. Limori, that we have inequalities. So most people are quite poor, and therefore accessing the services is hindered by the fact that they cannot even have transport to go to these services. Most services are located in central CBD, but then most people will not be able to live around that because of the poverty. They live very far from the central areas where the concentration of services are. So poor financial circumstances are also issues which would lead to poor accessibility to mental health accessibility. So the other theme which we found, or which we identified, was the health system related barriers. So the structural barriers which were related to the health system were very, very eminent or very important in our findings. The stories of African migrants identified health system related factors as influencing their decisions to accessing the mental health services. For example, an availability of quick appointment by a doctor, because some of the time mental health issues will come and you need to see a doctor, but you may not be able to get a doctor immediately. You have to be waiting and waiting and waiting. So I have some quotes which were very, very interesting in this study. And one participant from Burundi talked, you have to book and then maybe they'll give you an appointment next week. And by the time you reach on that day, maybe that feeling which you had at the time when you needed it, then you have lost somebody, or at home there's something which is happening. So these are some of the stories which are very important. Or sometimes you want an appointment to see a doctor. Every time you ring, they say, oh, we are full booked. Maybe call us in 2 weeks' time. And then two of my families have gone. What do you do then? So these are some of the issues. Being sent by a different GP was also one of the issues which people thought was a problem in terms of there's no consistency in accessing the services. So people are being disappointed because they are not being listened to, because they have not been acknowledged, and sometimes they feel very rejected. So the third theme which we had in our finding was social cultural factors. And these have been mentioned by Dr. Lemori and the other speakers who talked before. We talked about issues such as mental health stigma. This is a big elephant in the room. People feel ashamed by really feeling that they may have mental health. So it's a big factor that deters people from accessing mental health services. And stigma can include discrimination, can also include ostracization from the society, and can do even greater harm to individuals that are struggling with mental health issues. Stigma can affect anyone, and it's not only the cold migrants who can be affected by stigma. Anyone can be affected regardless of their origin. However, people of color or migrants, they really tend to have really high branch of stigma, because people with mental health issues to fear to be judged or to be seen as even accessing mental health services. So in our African community study in South Australia, most participants' stories suggested that mental health stigma, social isolation, and fear of being left alone led them to avoiding accessibility or even accessing or seeking help to mental health issues. In line with stigma, some of the other issues were cultural practices within our communities. There are so many cultural practices which are significant barriers to accessibility of mental services. For example, cultural practices related to spousal relationship and individual power within the families So the women, particularly relating to Dr. Memori, are not allowed to make decisions even to go there. So they have to ask permissions from their spouses. Some of the really big quotes which I wanted to share with you is another one. Men as well, they are not very easily recognize the mental health because they will feel they are weak. As men, they are very strong, so when you have mental health, you may feel that you are weak, and this is not something you want to reveal. So one quote which I want to share is, and they feel that they are not macho or they are not men enough because they are usually hurt when you feel that you are weak, and therefore you will not seek help. Religious issues were also very important, and people related it to religion leaders more than the services which would be available. So religion perspectives seem to have strong influence in African migrants in response to mental health problems themselves and also in response to accessing mental health services. And this was not only in one religion. We interviewed people who were from different religions, and the searching support from the religious people was more important than seeking support from the services which were accessible or which were available. So just to finish, then I'll just say quickly what can be done. Then we know this is a problem. We know the cold migrants have more disproportionate affected by health services. But then what can we do? We know that they really work well with the religious people. So Mental Health Foundation should continue with what they are doing to put more concerted effort to improve mental health awareness. So more education, increasing more education to include religious people, to include leaders of the community, and we have a lot of stories, including women, because women are sometimes not involved in morning cultures, but we have heard stories even from what Kwame was talking and what Dr. Memori talked about, discussing issues of stigma and to normalize mental health to be known to many cold migrants and to be seen as something which can be helped, and also to advocate for services to be more culturally acceptable, culturally safe, so people can go to seek help because help is there, and having more people accessing these services will be more helpful than just providing services which are not accessible by many migrants. Thank you very much.
Thank you. Thank you, Lillian. Please accept this incredible gesture of appreciation and inviting Mr. Luke Gosling and B to hand over that.
We should get that signed. This is just a small token of our appreciation here for you making the trip up from Adelaide. Thanks very much for that informative talk that I'm sure we all got something out of. Thank you very much.
Thank you very much. It's been my pleasure, and really, I should thank you because it's very exciting to go to a plane and to go to somewhere else. After the 2 years of continuous battle, and then
No.
we were very happy.
So the last speaker before the morning tea, I will now like to introduce Valkai, who has sent through a pre-recorded address for us today. So Valkai is a spirited advocate for a multicultural Australia. He works to develop the capacity of multicultural communities with a focus on leadership development, education and employment outcomes. His involvement extends from working with individual communities to advocacy at the highest level. His work informs the direction and policy of service providers, businesses and all levels of government. They have held many leadership roles within Victorian multicultural sectors and has been widely recognized for his advocacy, community service and professional achievements. This recognition includes the Victorian Multicultural Commission's emerging leadership in multiculturalism award, that has strong commitment to promoting harmony by engaging and bringing communities together to build a vibrant society. His practical, hands-on approach is well recognized within multicultural communities. He currently chairs the Victorian Multicultural Commissions of Gippsland Regional Advisory Committee and is a Multicultural Ambassador for the Mental Health Foundation of Australia. Please join me in giving this speaker.
I would like to acknowledge the traditional Aboriginal owners of the country throughout Australia and pay my respect to them, their culture and their elders past and present. My name is Boyke and I'm the Deputy Chairperson for the Victorian Multicultural Commission. The Victorian Multicultural Commission is an independent statutory body that advocates for and promotes cultural diversity in Victoria and across all levels of government. It is an honor to be asked to speak today about the mental health of people from refugee backgrounds. It is nice to know that there are so many of you who care and want to hear about our experience. Maintaining good mental health through the COVID-19 pandemic has been a challenge to most Australians. I know it has been for me. Social distancing, lockdown, curfews, hotel quarantine, military enforced isolation at home are new realities most of us had no concept of 2 years ago. They need necessary measures to control the spread of a deadly virus, but which has really disrupted our lives in the process. Although more than 1,200 people have died from COVID-19 in Australia, each of them leaving behind families and friends, we know we have contained the spread of the virus better than most countries, but one death is far too many. Still, we all struggle through this time in our own ways, and our diverse communities, including new migrants and refugees, have had to bear some of the most damaging effects of the pandemic. For instance, many culturally and linguistically diverse Australians depend on casual workforce, particularly in industries that are most impacted by lockdowns. Some of these people have not been eligible for government assistance. Diverse Victorians here who have been allowed to work through are often the frontline workers and more likely to be exposed to the virus themselves and then risk bringing that back to their families. It is a daunting experience. Compounding the loss of loved ones to the virus and the genuine fear of contracting the COVID virus themselves, core communities have really suffered the consequence, and it has impacted their mental health and well-being. There has also been a wave of racist attack that has increased towards many of our core communities, both in person and online, following media reports on outbreaks. And it's heartbreaking to know that our communities are divided by preventable hatred. The public housing tower lockdowns here in Victoria also affected many recent migrants, people of refugee backgrounds. The arrangement was enforced rapidly, and so did many issues arise. Some residents were locked out of food, medical necessities in their homes, while others did not have access to outdoor space for fresh air. The large police presence was confronting and triggered memories of past trauma for those who had lived through many conflicts in the past. With all of the fears and uncertainty, people need to be with their communities more than ever. Because of social distancing, we can't, and it's a difficult circumstance we're all going through. In a way, it is the perfect storm for our mental health crisis. Fortunately, many faith and cultural leaders have truly stepped up, and I have been inspired by their tireless, selfless work for their communities. At the Victorian Multicultural Commission, we have seen this work close, and we have hosted fortnightly COVID for our core communities. We've heard from numerous leaders who have shown it's okay to admit that you're not coping well and that it's okay to speak out. I'm also a very proud Multicultural Ambassador for Mental Health Foundation of Australia. Like my fellow multicultural ambassadors, we have been actively engaging with our communities to break down and reduce stigma about mental health and accessing support services. I sincerely believe that we all have a role to play to support our communities to have a better understanding about mental health. I feel the shift occurring in how migrants communities speak about mental health, and this is a promising and a great thing. And now I hope that mental health industry can do even more to serve the diverse needs of our communities. It is still hard for our core communities to access high quality psychological help. I know many psychologists and counselors already do bulk bill work, but I would love to see an almost pro bono culture developing among alternative practitioners. It would be wonderful to see all Australia's most experienced psychologists committing to doing a portion of work each week with bulk bill clients from core community backgrounds. It would be a compelling work and would make a huge difference for our communities, not just their clients, but also to the wider society, so that we all can build a sense of belonging and recover. My final message is, for those of our community members going through mental health issues, please reach out and don't suffer in silence. I want to let you know that there is help out there, so please reach out and seek help. To our mental health service providers, I sincerely hope that you will continue to seek innovative ways and ideas on how your services can better address our community's needs. Thank you once again for the opportunity to speak, and I want to wish you all a happy Mental Health Month, and I hope that we can continue working together towards the goal of a better mental health for all. Thank you very much.
All right, finally, thank you both. Talking of appreciation, listening to you. So, morning tea is arranged just outside of the room, and we'll give 10 minutes maximum so we can come back. So, we can hopefully finish by 12 o'clock. Thank you.
Did you figure that out? Did you figure that out? Like that, it's gonna be the video is gonna be on that space. It won't be straight. It will be tilted. It's gonna go to landscape. Trust me, I tried it before. So. I need to take a takeover of the people drinking tea as well.
It's a wonderful after.
Quality, better camera, better.